The Omicron surge is letting up in some places that were first hit hard by the variant, but the rest of the nation is still fighting a difficult battle. CBS's Michael George reports.
Omicron-fueled COVID cases are still surging across the nation. More than 5.4 million Americans tested positive last week, a new record. But the story is changing in New York City, where numbers are dropping fast in both cases and hospitalizations.
We are winning. You sent a clear message that vaccinations and booster shots are successful.
New York was one of the first places hit hard by the variant. And while the city is improving, health experts are warning COVID is here to stay.
If you look at the history of infectious diseases, we've only eradicated one infectious disease in man, and that's smallpox. That's not going to happen with this virus.
At-home testing is considered a key tool in the battle against the virus. And today, the White House took action, quietly launching covidtest.gov, a website where Americans can order free tests.
Every website launch, in our view, comes with risk. We can't guarantee there won't be a bug or two, but the best tech teams across the administration and the Postal Service are working hard to make this a success.
The tests will be limited to 4 per household and are expected to ship within 7 to 12 days of ordering. Michael George, CBS News, New York.
For more, I want to bring in Dr. Celine Gounder. She is an infectious disease specialist and epidemiologist at the NYU Grossman School of Medicine and Bellevue Hospital. She is also the host of the Epidemic podcast about the COVID-19 pandemic. Dr. Gounder, welcome. Thanks very much for joining us. As Omicron slows in some places, COVID deaths across the country have risen more than 5% in just 1 month. Do we have any indication when the Omicron wave may retreat?
I think it's important for people to understand that while we are starting to see Omicron peak in places like New York City and Boston, these very dense northeastern urban centers, it will take longer to see a similar kind of peak in other parts of the country. So we're probably another 2, maybe 3 weeks away from Omicron peaking across the country. And of course, hospitalizations, as we've said for the last 2 years, tend to lag cases because it takes time from when you first get infected or exposed until you get sick enough to end up in the hospital. So we're still looking at, several weeks at least of the impacts of Omicron on people across the country.
In the midst of that, there is bipartisan pressure to keep schools open despite Omicron. What are some important decisions, doctor, that are factoring when and if to shut down schools?
Look, we've learned a lot since the beginning of the pandemic. We know what measures work. Top of the list is vaccinations. Children 5 and up are eligible for vaccination, and yet in that 5 to 11 age group, less than a quarter of kids are fully vaccinated. So that's the first layer of protection that both staff and students should be taking to protect themselves. In addition, we know masks are highly effective, and we're counseling people to up their mask game, wear higher quality masks like N95 or KN95 masks. And then you have sort of the cherry on top of the sundae with things like improved ventilation or air filtration, HEPA air filtration units, and testing. But even if all the school is able to do is vaccinate and have students and staff wear masks, you're 99% of the way to reducing your risk.
On those upgraded masks, doctor, I just have a question. I'm wondering, are those KN95s widely available for kids who obviously have smaller faces? As I understand it, the point being the seal is supposed to be superior to, say, a surgical mask.
This is a really important point. They are less widely available in children's sizes. If you actually go to my Twitter, I will repost this again, some links to some places where people can find children's sizes of KN95 masks. And my Twitter is my first name, last name, Celine Gounder. But yes, this is an issue. We do need to make children's sizes for KN95s, N95s more widely available.
And as far as breathability, just so parents know what to expect, because having worn N95s and KN95s as an adult, there's a noticeable difference between what that feels like and a surgical mask. Even when you put a cloth mask over it, it's a very noticeable difference.
Well, N95 for sure. KN95s are pretty easy to wear comfortably. I can tell you my 6-year-old niece made the switch from cloth masks to KN95s and really had no issue at all. It was the same to her. Those are very wearable, even for kids.
All right, some good information for parents out there. Meantime, CDC Director Dr. Rochelle Walensky acknowledged that she has not been clear enough with the American public. What is she vowing to improve, and what would you like to hear from her and the agency?
Well, I think, first of all, the Biden administration, the CDC and others, really anybody who's a public health leader or expert who's speaking in the media should have been saying from the beginning, the one thing we can count on during the pandemic is that things will change. Our guidance will change because it will need to evolve with changing conditions on the ground, with what we learn of the science. And I think that needs to be very clear that that is the only thing in some ways that we can truly count on. I think the other aspect that would be helpful with respect to the CDC is having more public briefings, which the director has already vowed to do, so that we better understand the science straight from the mouths of the CDC scientists doing that work. And I think it's also humanizing for the agency for us to understand this is not a faceless bureaucracy, that these are scientists who really are working very hard, doing their best. And finally, I think many of these decisions are not just about science. They're not just about public health. They're also about social concerns, the economy. And I think being very clear in laying out all of those different priorities and how they're being analyzed and weighed would really help people understand the decision making here that much better. Do
you think that job of messaging when it comes to public health is a much more difficult one now that we are a couple of years into this pandemic? And given the fact that, for some Americans who have been confused, it can feel as though there may be contradictory information that has been passed along to them at various points, when it's the science we know that is evolving.
Well, some of it is the science is evolving. Some of it is there are different trade-offs with respect to, again, public health priorities versus, say, keeping schools open or the economy open. And I think being very clear about, okay, this is what the science tells us, these are the societal and economic concerns we're weighing here, really would help clarify the decision-making.
Well, there is some preliminary data out of Israel about a 4th coronavirus shot. Doctor, what are we learning about how that's worked out so far?
There does not seem to be much benefit of a 4th shot, in particular against Omicron. Part of what made Omicron different is that it has mutated significantly, so it's fairly different from the spike protein that we're using in the vaccines or that are encoded for in the vaccines. So your target has shifted in a sense. What the vaccines do is they do an additional dose will boost your antibody levels, but it appears that those antibodies may still not be sticky enough for this new target. I think what you're going to see is an effort to develop new vaccines, new second-generation vaccines, not necessarily specific to Omicron, but to parts of the virus that are less changeable, that mutate less, and that also target other coronaviruses, not just SARS-CoV-2, but also the original SARS, perhaps also MERS, Middle East Respiratory Syndrome, and others.
On a related note, does there need to be a change in the definition of what it means to be, quote unquote, fully vaccinated?
I think the CDC is holding off on that at this time, in part because where we're seeing the strongest benefit of a 3rd dose of vaccine in the United States is really still among the elderly, the highly immunocompromised, people who live in congregate settings like nursing homes and other especially vulnerable populations. But for a young, healthy person, there's really not an added benefit. That said, if you know somebody who falls in one of those high-risk groups, again, the elderly, highly immunocompromised, living in a nursing home or other such setting, and you know that they have not yet gotten their booster dose, please help them. Or if you're one of those people, please go out and get that booster dose. That really does help protect those particular groups against the risk of hospitalization and death.
As we mentioned earlier in the program, the White House is just now offering Americans free at-home COVID tests. How critical is testing to slowing the spread of COVID?
There are a couple of roles for testing. One is that it helps you know, are you contagious? So are you a threat to other people? is it safe for you to go back to school in person or to the workplace? And in particular, that's the case if you're going to be indoors not wearing a mask. It's really important that you not be contagious to others. Hopefully that's not the case, and most people are wearing masks. In addition, it's really important to have testing as a foundation to get people on treatment. And we're finally getting to the point where there are antiviral pills like the new Pfizer Paxlovid pill, but a groundbreaking pill like that will have no impact if people can't get the diagnosis easily, quickly, cheaply, so that they can get treatment.
And Doctor, just one last question. How should Americans be thinking about this pandemic? You know, we used to talk about a quote unquote return to normal. But as has been pointed out, if you are the parent of a child under 5, too young to be vaccinated, that means something very different and may feel premature. What would you say to Americans who are obviously very weary at this point of the pandemic of carrying out these mitigation measures, the social distancing and the masks, with so much still very much uncertain with respect to the science?
I don't think we're going to be able to jump in a time machine and go back to October, November of 2019. SARS-CoV-2 or COVID are here to stay. The question is, how do we adapt? How do we evolve to make this a more livable, sustainable situation where our hospitals are not getting crushed, where we can socialize more normally and the economy doesn't close and suffer from setbacks related to the pandemic? That means being prepared for the next variant, because there will be more variants after Omicron, and making use of the tools at our disposal. And you mentioned, children under 5. For the kids 5 to 11 who are eligible to be vaccinated, who are not yet vaccinated, they absolutely should be. For those kids under 5 who are not yet eligible, we do anticipate sometime later in the spring, they finally will be. And so that will be a great opportunity for those remaining American families.
All right, so many parents anxiously awaiting that. Dr. Celine Gounder, it's really great to have your insight. Thank you very much.
My pleasure.